Are you suffering from buttock pain? Are you suffering when you sit down and it's aching away, or possibly when you're walking and it's hurting in your buttock? Maybe it's hurting all the time in the buttock. Well, it's a natural reaction to want to stretch it out because it feels tight and it feels irritated. And so if we stretch it out or massage it with a massage ball, that's going to be something that makes it feel better. And you're absolutely right, it can. But there's a really, really important thing to do before you stretch it out that can make it much more effective and stop it being a temporary relief and actually make it a permanent relief. And that's what I'm going to show you in this video. So my name is Nigel and I'm a physiotherapist. I have my own clinic in the south of England in the UK. So if you walk through the door today to my clinic, these are the things that I'm going to tell you to do. So if you have pain in your buttock, what we need to do is we need to treat the cause and not necessarily just the symptoms. Now the cause is actually most of the time due to your lower back. It's not the hip, that tends to be more groin symptoms. When you have buttock pain, it tends to be related to lower back dysfunction or pelvic dysfunction. And so without addressing the cause, what we're going to find is we're going to treat the symptoms, and either the symptoms are going to be a little bit better or they'll actually be a bit worse, because we'll be pulling against a restriction when we do our stretches. So this lower back area is so intimately linked with the glute, the gluteal muscles around this area here. And so the nerves can be irritated, and sometimes it's the superior gluteal nerve that translates away from here and into those buttock muscles. And sometimes it's the deep piriformis muscle that's gone into a lot of tension. And so with the piriformis muscle, the sciatic nerve actually passes right next to, or sometimes through, in a small number of cases, the piriformis muscle. And so that proximity of that nerve to that tissue means that if there's any irritation coming from the lower back, it can often radiate into the gluteal muscle and cause it to tighten up. It's not unusual at all to have no symptoms in the lower back, but to have buttock pain solely in this area. But there's no particular issue with that buttock. That's where you're experiencing the pain. The dysfunction is actually in the back. So what I'm going to get you to do is some back related mobility exercises that you should do before you do your stretches. And then we're going to move on to our gluteal stretches, which should be more effective and more longer lasting by addressing the stiffness in the lower back first before that tightness in the glute. Okay, so what we're going to do to begin with is some pelvic tilting. So we're going to sit on the chair and basically we're going to slightly tilt back our pelvis, and then we're going to sit upright. Tilt back and sit upright. And we're going to do this nice and slowly with control, and we're going to do this for 10 repetitions, up and down. Now it's very important that if there are any pains that go into your buttock when you're doing this exercise, that you only go as far as the edge of that discomfort and back up. I wouldn't recommend that you did this exercise if it was causing your pain to get worse. That really goes for any exercise. You should take it to the edge of discomfort and back up. And so this is just mobilizing the lower back by relaxing down and sitting upright, relaxing down and sitting upright. A nice mobilization through the lower back segments. Now, the next exercise is an absolute game changer. It's very, very important in terms of the mobility of the lower back that you have adequate rotation. And rotation is a fantastic cheat exercise because it really does mobilize those structures to help you to loosen them up. So sitting again in a nice good upright posture, all you're going to do is you're going to reach around to one side, put your hand on the opposite knee, twist round, and then do the same the other side. Hand on the opposite knee, rotation, round. Hand on the opposite knee, rotation, round. And so you don't want to go too quickly because we don't want to do it jerky. We want to keep it nice and smooth. And we want repetitions, consistency. So I would recommend doing 20 repetitions, so 10 each side as an absolute minimum. But you might want to do a few more of those because you'll find that as you continue with them, you'll actually loosen up as you go. I wouldn't expect you to get too much radiation of discomfort into the glute by doing this, other than maybe some discomfort that you have from naturally sitting on it anyway. So after you've done those two exercises, what you can then do is start to stretch it as you might like to. Now the gluteal muscle is a fan-shaped muscle. There's lots of different fibers in different directions, which means that different angles of movement actually stretch different portions. So we might find that stretching the leg over in this position will stretch one element of the gluteal muscle, but if we put it up to a more flatter position and try to push down, it will stretch a different part. So it's a good idea to do various different angles from the hip and find the ones which feel good, the ones that feel tight but feel like a release at the same time. So if we start with the first one, we're going to put our foot on top of our knee and then gently just push down and sit upright in the lower back. Now we should feel it in the side of our hip and just stretching gently, not forcing it, and it certainly shouldn't be increasing any discomfort by doing it. We want to hold it for about 30 seconds, and once we've done that, we could do it on the other side. So stretching on this side, I'm a little bit more tight on this side compared with the other side, so I can only take it that far, and that is the case for you, that you should only take it as far as you can. But whichever side is uncomfortable, it doesn't matter. We should still stretch both sides because it will still help both sides. So the next exercise, we'll cross one leg over the other, and we'll just, this time, instead of pushing the knee, we're going to pull the knee towards us. So a pulling motion towards the opposite shoulder, really. We're going to pull that way and we're going to hold it for 30 seconds. And after we've done our 30 seconds, we will then do the same on the opposite side. And as I say, I am much tighter on my left side. I need to do more stretching. And we're going to pull it towards the opposite shoulder and hold it for 30 seconds. Now these are great stretches for anything around that gluteal area. You can of course do some gluteal stretches in lying down, but that's beyond the scope of today's video. We're just talking about doing some exercises in sitting. So finally, we can combine the two exercises of mobilizing the lower back and stretching the gluteal with a combination. So if we put one leg over, and then what we're going to do is stretch round to the side that we've lifted. And we're going to hold that for not 30 seconds on this occasion, because that's quite long to hold the rotation stretch. We're just going to go for a 15-second hold on this position. And then of course we can repeat it. This is to my stiff side. First of all a hug, and then rotation to the other side, holding for 15 seconds. Now those are great exercises, and the combination of mobilizing those lower back segments and stretching the glute can be a great winner when it comes to improving buttock symptoms. So you might have come across one of these, which is a spiky massage ball, and these can be used to put direct pressure onto sore bits in our gluteal muscle. You should take care with this, because although it can feel like you're really getting into the soreness, if you do it too much, it can often make it more sore. So I would recommend that you use one of these leaning against the wall, especially initially, and you press onto it gently move it around, and combine it with the exercises that we've talked about in this video as well. I would only use it for about 30 seconds at a time, and as I say, do it to a level which is only moderate to mild discomfort when you are pressing. Do not feel like you should press the harder the better, because that's often the wrong strategy. So there you go, some simple exercises to do that can help to reduce the pain in the buttock. Get rid of it, move on with your life. I hope that helps. Let me know in the comments if it did. Cheers.